Do your legs ever feel heavy by the end of the day? And I don't mean sore like you just worked out. I mean that deep, dull, weighted down feeling. Maybe your ankles swell, maybe your calves ache, maybe your skin starts itching and you don't really know why. Most people brush this off and say, I stood too long today, or I'm just getting older. But here's what you need to know. In a lot of cases, that's not the real reason. What you may actually be dealing with is something called chronic venous insufficiency, or CVI. And once you understand what's really happening inside your legs, and all of these symptoms start to make sense. Let's get straight into this, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people. So if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. So guys, here's a simple version of what's going on with chronic venous insufficiency without getting too technical. Your veins are supposed to move blood upward from your legs back to your heart, right? We all know that, but remember, gravity is working against you, so your body uses these tiny one-way valves inside your veins. These valves open to let blood move up, then close so it doesn't fall back down. In chronic venous insufficiency, those valves stop doing their job properly. Blood leaks backward, pressure builds up, and blood starts pooling in your lower legs. That pressure buildup, that right there is the core problem. That's what makes your legs look like this, often starting in the ankles and calves. And what's interesting is CVI usually doesn't hit you all at once. Early on, it's subtle, it whispers. You feel heaviness, mild swelling around the ankles, aching after standing, night cramps, restless legs. If you can relate, let me know in the comments below. What's happening underneath is increased venous pressure triggering inflammation. We talked about that pressure, right? But that very pressure is causing all of this inflammation. Your capillaries then become leaky, fluid moves into the surrounding tissue, and oxygen delivery to the skin drops. And over time, this shows up as what is infamously known as varicose veins, skin darkening, thickening, rashes that look like eczema, and in more advanced cases, slow healing ulcers can form. So no, this isn't just a cosmetic issue, guys. This is real circulatory dysfunction. One of the most common questions I get is, okay, but why me? How did this happen all of a sudden? And the answer is usually not just one thing. Let's break down some of those causes. Firstly, genetics. Genetics is going to play a big role in how strong your vein valves are. Sitting or standing for long periods shuts down calf muscle activity, and this matters because your calves act like a second heart, pumping blood upward every time you move. So if you're sedentary, chances are you can develop it too. Can you guys think of another reason that causes pressure on the leg veins? If you guessed pregnancy, you'd be right too. Any extra body weight increases abdominal pressure and blocks venous return. Another cause that comes to mind is having a previous blood clot, which in some cases can permanently damage valves. Also aging, which reduces vein elasticity. So let's recap. Genetics, a sedentary lifestyle, pregnancy, extra abdominal pressure from extra weight, a previous blood clot, and aging are said to be the main culprits. Another thing I really want to clear up is this idea that chronic venous insufficiency only matters if it looks bad. And that's not true. Guys, the reality is persistently high venous pressure leads to four things: chronic inflammation, poor oxygen delivery, impaired healing, and higher infection risk. An acronym I use to remember this is IPI: inflammation, poor oxygen, impaired healing, and infection. Over time, it can even affect how well you move, how your legs feel, and your overall quality of life. This is why vascular doctors take CVI seriously, because circulation is foundational to health. Okay guys, now let's talk about what actually helps. I want to be clear, and this part is evidence-based and not just some random internet advice. So if you know anyone who has legs, calves, or ankles like this, share this video with them. The first and most powerful thing you can do is move, specifically activating your calf muscles. Walking, cycling, and heel raises physically squeeze the deep veins in your legs and pushes blood upward. Study after study shows that regular movement improves venous return, reduces swelling, and slows progression of CVI. And here's a key point: moving frequently throughout the day is often more effective than one intense workout if you're otherwise sitting most of the time. I actually made a video on Soleil's push-ups and how effective they can be, which you can watch in this video here. Secondly, compression therapy is another big one. Properly fitted compression socks apply graduated pressure They are tighter at the ankle and lighter as you move up the leg. This directly counters venous pressure and helps valves function better too. Large clinical trials show compression reduces pain, swelling, and the risk of ulcers. The mistake most people make is waiting until things get really bad. Compression works best when you start early and actually stay consistent with it. I've left below a few that I like on Amazon, and for full disclosure, they are affiliate links which do support the channel. And just an extra bonus tip here, guys, wearing dirty compression socks traps sweat, bacteria, and fungi against the skin for hours. That increases the risk of folliculitis, fungal infections, cellulitis, and skin breakdown. So make sure they are clean before each use. Don't wear them if they haven't been washed, basically. A common mistake that can really easily be avoided. Thirdly, leg elevation sounds simple, right? But when done right, it's powerful. When your legs are elevated above heart level, pressure inside the veins drops, pooled blood drains, and inflammation decreases. What I would do is 15 minutes twice a day, which is going to noticeably make a difference. Set reminders on your phone to do this as well. Fourthly, your weight and metabolic health also matter more than people realize. Excess abdominal fat increases the pressure on the veins that drain your legs. Chronic inflammation and insulin resistance damage the lining of blood vessels too. There's no other way to put it, especially if you have a higher HbA1c. You're going to want to look into that. And there's a ton of research that shows that weight reduction and better blood sugar control improve venous symptoms too by lowering both the mechanical pressure and the inflammation. Supplements like Berberine help you reach those weight targets better when they are used correctly, which I've also linked for you down below. And fifthly is some skincare tips, because the wrong products can actually make things worse. The most evidence-based creams for CVI-prone skin are thick, fragrance-free emollients that restore the skin barrier. Look for ingredients like ceramides, glycerin, petrolatum, urea at low concentrations, and colloidal oatmeal. These ingredients reduce transepidermal water loss and calm inflammation, which lowers the risk of dermatitis and ulcer formation. If your skin is very dry or thickened, urea-based creams in that 5 to 10% range can be helpful because they hydrate super well. And what you want to avoid is fragrance lotions, essential oils, menthol, camphor, eucalyptus, and any strong botanical extracts. Another thing people don't realize is that hot water makes your venous symptoms worse. Long hot showers cause vasodilation, which increases venous pooling and can worsen itching and swelling. Lukewarm water is much better for CVI skin. Now the question everyone asks is, can CVI be reversed? Here's the honest answer. Damaged valves don't regenerate, but progression can absolutely be slowed or even stopped, and symptoms can improve a lot. There are also minimally invasive procedures like endovenous laser or radiofrequency ablation, which can help a lot as well. These close off the dysfunctional veins and reroute blood through healthier ones. And long-term data shows really strong outcomes when these procedures are combined with lifestyle changes. But that's the frustrating part, guys. I also read about that most people end up where they first start off, because after they get those procedures done, they resort back to making poor lifestyle choices, which is sad to see. Don't let this be you. And on that note, I do want to say something. If you're dealing with persistent swelling, skin color changes, worsening pain, or leg ulcers, it's time to get that checked, guys. Also, a venous ultrasound is painless and shows exactly how your valves and blood flow are functioning. So ignoring CVI doesn't make it go away. You're going to need to do something about it. And if you need a sign, let this video be that reminder for you. So here's the big takeaway, guys. Chronic venous insufficiency isn't your body betraying you. It's your body responding logically to gravity, stillness, and pressure. When you restore movement, reduce inflammation, and support venous flow, your symptoms will improve. Why? Because the physiology improves, and when the physiology improves, the results will show. If this video made things click for you, consider subscribing and watching more videos here. And until then, guys, I'll see you on the next one.